They were charged thousands for ambulance rides, then wrote to Contact 6.
Jenna Sachs with the bill being called indefensible.
I didn't want to go.
It's a 42-mile ambulance ride Christine Kaliva took reluctantly. She'd been staying in a Lake Geneva hospital after puncturing her lung. The hospital transferred her to Rockford.
I refused, and they said, you can't refuse. You need to go.
There, she recovered.
A few months later, I received a bill from Superior Ambulance.
Before insurance, $9,600. After insurance, still more than $5,000.
I just feel like this bill is outrageous.
When a patient has health insurance, an ambulance company first sends the bill to the insurance provider. The insurance company sends payment for the amount it covers to the ambulance company, who then bills the patient for the remainder.
There isn't a hard and fast formula that they use.
EMS billing consultant Maggie Adams says ambulance providers struggle with high operational costs, retaining employees, and low Medicare reimbursement rates.
It has been such a hard go for the industry.
It's a struggle ambulance providers share, but Contact 6 discovered the billing is where Superior Ambulance stands alone.
They said they're not going to pay anything more because Superior charges were above anything reasonable.
Christine's ride was at the highest level of care ambulance companies provide. Yet Christine's insurance company, WEA Trust, calls her bill from Superior unheard of and indefensible, saying this sort of abuse should not be permitted. WEA Trust sent Christine a list of claims from other Wisconsin ambulance companies. It shows for the same type of transport, many other companies billed less than $3,000. Superior billed $6,000 and higher.
Not disputing the service, disputing the outlying cost.
Michael James took a 5-mile ride between hospitals with Superior that cost $7,700. After insurance, he was still on the hook for nearly $6,000.
When in an emergency you don't have time to comparison shop for something that's outside of insurance, you're stuck. And that's exactly where I am. I'm stuck.
Superior would not go on camera, saying it cannot comment on the fees for other ambulance companies. Superior says its charges are necessary to provide competitive wages and benefits for its employees, and insurers should provide fair reimbursement. As for the patients,
the hospital usually calls the ambulance, so they had no choice in the matter.
The BBB of Chicago is investigating Superior Ambulance after getting 54 complaints about the Illinois-based company in 2 years. Among the grievances,
excessive charge for an ambulance. They did not realize what the charge would be.
Wisconsin's Department of Health Services also cited an ongoing investigation in its denial of our open records request. In Wisconsin, there's no statewide regulation of ambulance rates nor mandates that all insurers provide coverage. In the U.S., ambulance rides are a notable exemption to the No Surprises Act, which protects consumers from surprise medical bills. Contact 6 took a closer look at Christine and Michael's bills and found Superior also charged them $60 per mile of transit. Other providers told us they charge between $20 and $30.
I definitely think that Superior is wrong.
Christine is holding off on paying her bill, sharing her questions to help others get answers. I'm Jenna Sachs, Contact 6.
Mercy Health tells Contact 6, quote, although we can use any ambulance service available and we would like to provide a choice, hospitals are not always given that opportunity because there are very limited resources in Walworth County. Now, if you can't pay an ambulance bill, ask the provider for a conference call with the billing department and your insurance company.